Three, two, one, and we are live. Hello, everybody.
Good morning, good afternoon, good afternoon.
Oh, we got some great guests here today. We have Fulton, the co-host. How's it going, Fulton?
Hey, Dr. Scott, doing well today. Hope you are.
I'm doing great.
Good.
We got Jeanette and Joe from right here in Myrtle Beach, South Carolina. Hey, I'm glad y'all can be here.
Glad
Thank
to be
you
here.
for having us.
I've known you guys for a while, and you are patients at Advanced Medical. And so that's what we're going to talk about today. We're going to talk a little bit about what you guys have done, what you hadn't done, where you've been. You've seen a lot, Jeanette. You've been in the hospital system for 38 years. 39. Okay. 39 years. And so I'm interested in your perspective on the hospital system and some conventional modern medical techniques versus what we're doing in the new medicine model in Advanced Medical. I'm very interested.
That is why I came to you. Years ago, I had arthroscopic surgery at different times on both knees. When I injured my knee back in December, I looked into what was available. And I had a lot of people in my neighborhood who had the conventional cut open, pull out your bones and all that good stuff, and I wasn't interested in any of that. And I had heard about stem cells, so went online, started checking it out. My girlfriend told me about you guys, and that's when I made the appointment to come to you for an evaluation, but I had also at the same time made an appointment with an orthopedic just in case. I canceled that one after meeting you all.
Awesome. Well, tell me this real quick. What was the thing that you heard that sparked an interest or a commitment to cancel the orthopedic appointment, which ultimately was going to be cortisone injections and surgery? What was the thing that kind of said, you know what, I'm canceling that, I'm going to go in this direction?
Pain, for one thing. Not wanting to be put under anesthesia, cut open, having parts of my body removed and artificial pieces put in its place. The complications that can come with that. I have a neighbor who 5 weeks before I had my treatment had her knee replacement. She says it's the worst mistake she's ever made and that she will never do it again. She has been under anesthesia now for the third time because first it was the knee, then they had to put her under so they could do an adjustment of the mechanical knee. And then she had developed so much scar tissue that she just went under the knife for a third time this past Tuesday.
Oh, wow. What's the doctor's name that she said? No, I'm just kidding. I am kidding. Hey, thanks, Dave. I appreciate you letting everybody know about that. We're back here with Jeanette and Joe and Fulton. So you were just kind of making a difference. You were just kind of sharing the difference between the
old conventional way.
That's a great
new way to go.
Right. And so you have a friend who's just went under the knife a third or a fourth time?
Third time.
A third time. Here's what I heard, and you might know this. I hadn't studied it because I spend most of my time studying what we do and how we help people. Is it true? The more you go under anesthesia, the more it messes up your brain and your cognition and your thinking and memory, etc.
Anytime you take a lot of medications or anesthesia or anything like that, you're messing with your body, whatever it affects. I don't even like taking the medications that my doctors want me to take, like for my blood pressure.
Yeah.
And I one day swear I'm going to be able to get off of that.
Hey, well, I watch you. I watch the way you move your body and work up and down in that rehab department since you got these new knees. And hey, you're getting it done.
I'm trying.
You're getting it done. Joe.
Yes, sir.
Before, I think I may have met you, but here's what really sparked my interest just before meeting you is we're doing a reevaluation with Jeanette, and she said, hey, you know what? I got a phenomenal compliment the other day. I said, what is it? She said, my husband said I'm walking around like a 25-year-old.
That's true.
What'd you notice?
A lot of different things. You understand that the last year and a half, 2 years have been difficult for Jeanette. And the attitude about going under the knife, was he saying surgery? I did that in the military. I had to do it once, and I did it recently about 4 years ago for my knee.
Mm-hmm.
I understand that it's long, it's complicated, it's painful. I didn't argue with her when she brought your name up, and that's what brought up what you do in your organization. The first thing that came out of my mouth is, well, I'm not sure I believe in stem cell and all that voodoo stuff. We really got to take a look at this. Now, I'm being sincere when I said that.
Uh-huh.
Having said that, I started doing some really, really review on it.
Okay.
And my first and foremost is to make sure that this woman's happy. And one aspect of it, she goes, that's the way I'm going to do it.
She said, one
That's
aspect.
what I'm going to do. She goes, I'm going to get this done. I ain't
Okay.
going into the knife. This is the way I'm going to do it.
It also helped that our neighbor, who is an RN, knows quite a bit about stem cells, and talked to him and said it's not voodoo medicine.
Gotcha.
That was his big thing.
It's not conventional, and anything. Oftentimes, if we're unaware or don't know about things, if it's not conventional and the customary thing, we just throw it in the category of voodoo. Yeah.
Well, it's new. It was new.
That's right.
It's something that being of age now, I didn't know about this stuff until recently. But anyway, no, it's not true. Anyway, saying that, I play a lot of golf with her, and it's one of her passions.
Okay.
I played it professionally for a while.
That's awesome.
So
I just found that out. That's awesome.
Wow.
So I understand how the body should function and move, especially when you swing a golf club, which is probably the most difficult thing human beings can do.
Mm-hmm.
It's everything against your body. Spine-wise, head-wise, hip-wise, foot-wise, knee-wise. It does everything wrong for your body.
All at the same time. Every motion at the same time. Front, back, torque, twisting.
One movement back,
everything.
one
That's
movement
right.
to it, and it just doesn't work. You see poor boys screwing themselves in the grounds every single
Yeah,
day.
that's a good way to put it. That's a good way to put it.
But having said that, since she's had, which has been remarkable, when she had it done the first week, I saw the difference, and we were waiting till the time we could get on the golf course. She's a lot more functional in her lower body now because of her stable knees. Hits the ball longer, stays through a ball a lot longer than she did before. So it makes a difference. And I can only imagine if she went under the knife at this point, we'd probably still be dealing with this.
Ooh, right.
And that's what I didn't want. We both agree, we have so much time on this earth, I don't want to spend it in pain.
Right. You said you noticed a difference in her after 1 week.
Yes, absolutely.
That's awesome. How soon did you start?
One time, I waited a long time before I went out on the golf course because.
Oh, hold on. So you noticed?
No. I'm saying I saw a difference in the
time.
way she moved around the first week, and her big priority was to get on the golf course.
Right.
And she waited patiently for about almost close to 5 weeks by the time we really got out there.
But you noticed a difference in her, just the way she was moving after
Correct.
1 week of the injection?
Well, yeah, because I was
awesome.
hobbling back and forth
Mm-hmm.
when I walked instead of walking straight with a good gait. And it still took a while, even after the stem cell.
Mm-hmm.
I was doing better. But just like somebody who has to gets the surgery, you have to teach yourself to bend that knee again.
That's right.
You can't let the body just stay stiff and continue that way. You have to reteach yourself how to have a proper gait again. What he was talking about, too, was the first time we went out and played golf, my base was so much stronger, and that's why I was able to hit it longer.
Oh, that's awesome.
And people need to hear that. Then I looked at him and said, you might want to go talk to them because his swing wasn't quite as fluid as it had been.
Improve your golf game.
No, the biggest issue I had was my back. Continuous problems with my lower back. And my idea was to put ice on it, take a hot shower and call it a day. Did that for so many years. The neck started getting affiliated a little bit too. At that point, I just don't want to deal with the pain anymore. There's got to be another reason. There's got to be a way I can get this correct. And that's what I've started in the last couple of weeks with you.
That's awesome.
And I will tell you right now, I have friends that say, whoa, maybe you got that thing back a little bit. But what we've done basically is stretched out and see the best we can do with the way. We knew we have an area in that upper lower back right area because between x-rays and our conversations, you pointed it out to me. No question in my mind, that's exactly where it's at. So we'll deal with that a little bit for the next couple of weeks. And if that doesn't resolve itself, then we'll get the big boy out. We'll get the big boy out and start taking a better aim at it. Because I do want to correct it. I just enjoy the game too much. And I don't want to be sitting and different awkward positions to relieve myself anymore with back pain.
Yeah, I see it a lot. Someone like you who, I mean, you're a tough guy and you've been dealing with some stuff and you can handle pain. And I see it all the time. Someone coming in and, hey, let's do some basic stuff. Let's see if we get some progress, make some progress. And then ultimately, if it's not quite what someone wants, then like you said, we bring the big guns out, the stem cell, the regenerative medicine. As opposed to some people who are into a lot of pain, they're coming in and they're saying, hey, give it to me right now. Give it to me right now. And some people, that's what they need, or else they could get cut on.
Well, with my knee, I couldn't really put a whole lot of weight after I'd hurt it. And that just wasn't going to do for me. You know, I need to walk my dog. I need to play golf. I need to be able to do something in the garden. It was affecting my life too much. And that's when you go in and you say, let's do it now.
So pretty much what you're saying is the fear, the fear of the surgery, the fear of more pain, the fear of having to redo a surgery, all these things are really, it's not really the excitement of what it could have done for you. It's really the fear of avoiding more pain and more suffering and getting older faster and not being able to do the things you want to do is what kind of convinced you.
The motivation was no surgery.
Yeah.
And that way I also had a choice, because if this really didn't work for me, I still had the alternative.
Great point.
If I had done the surgery, I didn't have a choice anymore.
No turning back. That's right.
That was a great point. Factor with her all. She made that a point.
You're a smart lady.
And I understood that. Yeah. Because she has an alternative. If that doesn't work, then she has at least one more.
Yeah.
But once you take the initial and start getting, as I call the knife or the blade, you're done. That doesn't work.
And you know, what you're saying here, Joe and Dr. Scott, is we see a lot. Surgery is not the first option, okay? Surgery is the last option. You don't want to go straight to surgery. You want to do everything else you have possible. And when you have somebody such as yourself who has the interest to participate, has the right mindset, has the right outlook, that's half the game for the people who do what Dr. Scott and I do. We're looking for people with that mindset. When they come in and they have a negative approach on what we're doing, it's very hard to get them over that ledge, to get the positivity out of it that we're looking for. You and I talk about it all the time. It's not only physical, it's mental and emotional and everything else that goes into it. So congratulations. Good job.
No doubt.
Thank you. But you also have to listen to what your whole team tells you to do.
Yeah, that's true.
And you have to follow through. You have a responsibility for your own healing. And if you just go in and do the motions and not really commit to getting better, then you're going to fail.
Yeah, this is not a stem cell regenerative medicine. It's not a magic cure.
No.
You got to do the work.
Yeah.
Good point.
Just like anything else, too, because same thing if you go under the knife, as they say. The things you have to do to try to get back to normal.
That's right, yeah.
But then when that runs out, there are no more other options, are there?
True story.
No. I want more options.
Thanks, Dave. Yeah, that's awesome. We got all kind of stuff. Vitamin infusion, stem cell infusion, lots of things.
Yes.
We got some new
Yes.
We got some new stuff that came through the FDA.
Very exciting.
We're not even talking about it this week.
No,
we're going to talk about it next week.
To it next
I can't
week.
wait to tell you. I can't wait to tell everybody about it.
Exciting
It's
news
so
coming.
exciting. We busted our ass all year last year connecting with the FDA and different labs, the best labs in the country, to get some things covered under insurance plans. So we got some potential exciting news. But before, we're not even going to talk about that this week. What I do want, you mentioned the team and the providers at Advanced Medical. Tell me about them.
You have a great team. You really do.
I agree. Thank you.
Not only are they professional, knowledgeable, they're friendly. They acknowledge you by name when you come in that door. If you have any questions, they will sit down and talk to you and until you're satisfied with the information that you've gotten. They will catch you if you're doing things wrong and get that straightened out. And it's for your benefit, because when you do it the right way, you can feel the stretch of those muscles, unlike when you're only doing it halfway. Everybody in your office are top notch as far as I'm concerned.
Thank you. I agree. And that means a lot to me. let's talk about, you've been in the hospital system for 39 years, almost an entire generation. That's the alternative to what we do. What do you think the difference is? What's the biggest difference between having to go through a conventional medical route compared to going this advanced medical route?
Less medicines to poison your body with, less intrusive procedures.
Mm-hmm.
I mean, this was a needle in my knee.
How long did the procedure take?
Let's see, 15, 20 minutes, something like that, versus...
About $100 a second.
Not quite, but...
Was it worth it? Was it worth it?
but worth it.
Well worth it. Well worth it.
Hey, it's so worth it. He's going to be in there next.
Yes.
Yeah, that's true.
And just to let you know, Joe, the prices went up.
Yeah, I know. Just moved up to 200 a second. I know.
Such good results.
So tell me this. Okay, so you're in the hospital system for almost a generation.
Yeah.
What do the patients look like in the hospital system versus what you see at Advanced Medical?
Good question.
What does it look like? What is it?
You mean before, after, and during?
Meaning, like if you spend a generation in the hospital system, okay, you're seeing patients and you're seeing people with patients, and you're just seeing them, and there's a certain look, and then you walk into an advanced medical office. What does it look like?
Okay.
What does it
You
feel
see
like?
healthier people at Advanced Medical Solutions. You see people who move better, don't look as old. Even if they have years on them, they might come over a little hunched over or something from an accident or whatever it is, and it's all ages at Advanced Medical Solution. You have the younger ones as well as ones even older than me, and that's old. So I just think that they get better faster at Advanced Medical Solutions than they do in a traditional medicals.
What do you think about it, Joe? What kind of people do you see?
I see them. I've seen them through the military and through some of the things I've been through with people that get just surgery, whatever the case is, either because it was given to them or because they need it. They're constant. You see them in pain. They're in pain there. They're in pain while they're there, and they're in pain when they leave. They don't see anything until months afterwards or years afterwards. With your group, the bottom line on this is they come there with a smile on their face. The procedure is done. They're still smiling. Incredibly, they're smiling, and then they leave smiling, and then they come back smiling, and all they want to talk about is how to advance themselves. I'm now doing this. I'm now doing that, and I watched it with her. The day she went, I was a little concerned, but I wasn't concerned of the fact that when she left there, that I'd have to babysit her for the next 4 or 5 months. I didn't be concerned that she'd be miserable for 4 or 5 months. I didn't be concerned about we're going to take all these damn medications for 4 or 5 months, or even find a way to get to a bathroom for 4 or 5 months. She had both knees done, not one, both. Relief.
Great. Both knees done in the same day?
Yes.
Same day.
And that's not something that's normally done with surgery.
That's right.
They'll do one at a time, but they won't do both.
Right. Well, they don't do both because they need you to be able to move around. And you can't move around once you had surgery on both knees at the same time.
Right.
Well, what we did with her is we waited, was it 2 or 3 weeks after the first one? There was a delay before we had the second one done. Did we get both of them in at the same time?
We got them both done the same time.
I stand corrected.
There was over a month afterwards.
Oh, that was something else.
PRP.
Never mind.
We had
The booster
PRP,
treatment,
Yeah, that's it.
Yeah.
And I've had 2 of those, and even with those, I mean, that's where I guess your audience knows, but where they take your own blood and spin it down and inject your own plasma back into the knees and feed the stem cells, then I could feel a difference in the knees even after that, because you are feeding the stem cells and helping them regenerate even more.
That's right.
And the great thing about that is it's yours. It's not anybody else's.
It's true.
It's nothing that's going to be strange to your body. It belongs to you.
and it's not going through a major surgery. We talked a little bit about some bone marrow, aspirate, and adipose stem cell derived, and you're going through some minor surgeries to get those stem cell procedures done, which is good, but that doesn't have to happen. It's not the gold standard. You got the best medicine on the planet, and I think the proof is in the pudding. Yeah. You're doing awesome.
I feel awesome. Today, I played 18 holes of golf yesterday.
Oh, wow.
Wow.
I just had...
Yeah, I know.
On the knee that I had hurt, I did put my copper fit stretchy sleeve on.
Mm-hmm.
And I was hobbling a little bit by the 18th hole.
Mm-hmm.
We used a cart, but there was still a lot of walking yesterday. Last night, I took 2 Tylenol in bed. This morning, I didn't have a pain.
That's awesome.
Fantastic.
How can you argue with that?
You can't argue with that.
I played yesterday because I knew it was coming in today, so I figured you guys would work it out if I had any pain.
And they did.
So you woke up with a little bit of pain. Jeanette woke up with 0 pain.
Yeah, she rubbed that in this morning.
Yeah, that's the difference between a stem cell patient and
Yeah, all right.
And you know, Dr. Scott, one of the funny things you can see is the smile on Jeanette's face. I mean, you know, it's evident that she feels what she's saying here because it's written all over her face. So if everybody out there could see what we saw,
yeah,
it would just, you know, it is the proof in the pudding.
The interesting thing is I went to one of the dinners after I'd had my treatment.
Okay.
And brought my one neighbor. Ben asked me, that's one of his staff members, if I could say a few words, and he knew it was last minute. And if I didn't want to do it, from that, the people across from me came to your office and signed up.
Oh, awesome.
Because
have you seen them since?
Yes.
Okay.
Yes, and they said, you were the reason we came in.
And how are their results?
I haven't seen them recently because I think I'm on a different schedule than they are.
Okay.
But initially, when I first started coming, they were coming. And they were very pleased after they had something done. I'm not even sure what they had done.
How's it feel to know that by you somewhat being a pioneer in a new medical model, as something that you took the faith of moving forward with and sharing it with somebody else, that it potentially changed and saved their life? How does that feel?
Oh, that makes me feel fantastic, and that's why I wear your T-shirt every place. Joe can give you an example today.
That was unbelievable today.
Yeah, he went out to get the mail.
Yeah, I had a couple of individuals that were, I think they were remodeling or changing their home. My home was sold across the street from us, and these 2 individuals were over there, I guess, clearing it out, whatever they're doing. And I was in to get the mail, and the ones that go halfway across, he goes, hey, I need to talk to you. I wheeled around going, well, what are we going to talk about? So he walked halfway to me, and he kept pointing at the T-shirt. I said, what's going on? He's going, I got this shoulder problem, and I've been told. So we had a little conversation, and he felt the same way I did about evasive surgery. He's very concerned. He's very scared. I was in his mid-50s. He's self-employed. He said, I have 2 employees. I mean, he gave me a story. If I get this done, I'm out. I mean, I'll be out for 3 or 4 months. What do you think? And I went, I don't think you have any alternatives. So we tagged him up with you.
Oh, cool.
So
Awesome.
He's very concerned about it, and it's understandable. And there's another example where you have an individual that's sitting there going, if I have this kind of surgery, I know I'm going to be out for 2 and 3 months.
And it's going to mess up his business.
He says he can't afford it. He says, especially now with what's going on, the state's being closed down, he's not having any work, and now he's going back to work. So that's a nice alternative to have.
Awesome. Well, it's I think, and the way I think is this is the new medicine. It is not the alternative. Surgery is the alternative. This is the new medicine. You've been a nurse for, you're a nurse.
Well, I wasn't a nurse, but I was
You were
an
for
an addiction and mental health center.
And so if you've seen it, it's almost Neanderthal practice if it's done first. If this is something that should and must be done first, then surgery and pain medication, opioids would be a last alternative. I feel like that's the way it should be, and I feel like that's the way it's going to be.
And we hear that all the time. We talk to so many people who have had that knee replacement, and then what do they tell us? I wish we would have known about this first. I wish I could have taken this avenue first. And they can. Everybody out there, you can. You don't have to wait till afterwards and say, I wish I would have done this. You can do it now. Now's
we have
the time.
a lot of patients that come in with one knee replacement,
Mm-hmm.
and most of the time they're recommended to do another knee replacement. They're out. They're
Yes.
not doing it again. So we treat a lot of people with just one knee because they're refusing to go back.
I was going to ask you that because I've heard of that.
Yeah.
This one lady down the street from us is saying the same thing.
Yeah, Lorraine is saying that.
I'm not going to do this again. And
Yeah.
she has another knee to have. She has another knee she has to deal with.
And so you might be getting her as a patient down the road.
Okay,
You gotta
great.
Get this one done first, fixed.
Yeah,
So
she's still having
that,
issues with it.
Yeah.
That's the one that just went under the knife again Tuesday. Yeah.
Wow. And you know, that's a whole nother part of it. We haven't even addressed the complications that come along with surgery.
Absolutely.
The dehisced wounds, the infections, the risk of exposure to infections while you're in the hospital. Usually a surgeon is more concerned about you being exposed to an infection, to a pathogen, than he is worried about, a complication with the procedure he's doing. So let's just avoid that completely. Let's do this alternative, or when I say alternative, what is now becoming the normal practice of what should be done first.
Yeah, it's awesome. Well, hey, Joe and Jeanette, I appreciate you guys sharing with everybody in the Grand Shannon area and the world
My
watching
pleasure.
this on
My
the
pleasure.
internet.
Thank you for having us.
Anytime.
Thanks.
Keep up the good work. I'm so proud of you, and I'm very thankful for you. And I appreciate everybody. Thanks, Fulton, for everything
Always,
you're doing.
always. Thank you, Dr. Scott.
Yep.
It's very exciting.
I
Dr.
appreciate-
Scott, I'm thankful for you. And
Thank
your
you.
crew.
Me too.
Thank you.
Me
Yes,
too.
Thank you. Thank you. Thankful for the crew. Yep, the team is amazing. Appreciate everybody for listening on the radio in the Grand Strand PD area. Don't forget, restaurants are open back up. We're going to start having dinner parties
Yes.
again.
Yeah.
You guys are coming. You can tell everybody there about what you've experienced.
That's great.
And for those of you listening to the Grand Strand and around the world on the internet, see you next week.